Hi there. On the pages today, we'll share with you significant advances in our healthcare system. We'll also explore healthy lifestyle changes you should consider. Stick around because there's much more to come your way on Jamaica's #1 magazine program after this message and our news of the week.
It just makes sense that while we make hay as the sun shines, we should also save for the rainy days, because even as we all strive to rule our own destiny, life holds some inevitable and unexpected outcomes for which we should be as prepared as possible. Get the help you need now through the National Insurance Scheme. The NIS offers financial security when it's most needed to all gainfully employed or self-employed persons who contribute to this scheme. Whether it's loss of income due to injury on the job, sickness, retirement, and/or death of a breadwinner, there will be help waiting for you and your family. So if you are over 18 years of age and working, visit your nearest Ministry of Labour and Social Security parish office and get registered under the NIS. Start making your contributions in order to reap the numerous social protection benefits when that rainy day occurs. Email prunit@mlss.gov.jm or call 876-922-8000 for more information.
Hi there, I'm Simone Wolf with your JIS News of the Week. Ground has been broken for construction to begin on a 754-unit housing development at Rhine Park Estate in St. James.
We're not just talking about it. We're building the housing, we're providing the financing, and we're reducing the transaction costs to allow you to own your own home. Owning your own home in Jamaica has never been easier.
The Ministry of National Security is on target to rebuild or rehabilitate 149 of the 186 police stations in operation by March 2020 under a $5 billion project called Rebuild, Overhaul and Construct.
So there's a direct relationship between the performance of police stations and crime in their station areas. In other words, by improving the physical space of the police stations, officers are better able to perform their duties more efficiently, to have more meaningful engagement with the community, and a better crime outcomes as a result.
Prime Minister Andrew Holness has warned primary school administrators that no child should be denied access to an education due to any obligatory high fees.
I am not saying that the parents must not contribute, but sometimes we miss the bigger picture. And the bigger picture is to make sure that no child, regardless of the income status of their household, is in any way deprived of education.
Earlier in the week, the Ministry of Education reported a 1.5% increase in the overall passes for the CAPE and CSEC exams when compared to last year. Meanwhile, over 3,500 students from 17 primary schools across the island will benefit from a numeracy and literacy initiative being financed by the Jamaica Social Investment Fund, JSIF.
We're glad and we're proud to be a part of this type of intervention that is really putting education in its rightful place.
The Ministry of Health and Wellness has activated its enhanced vector control program to include public education, island-wide fogging, and home inspections by 1,000 trained and certified vector control workers.
This is a real challenge that we have, a real burden that we bear as a society, and a burden that as public health officials, as a government, we have to find better ways to respond to. And a big part of that solution is you. You have been selected to drive that army of activity in every community across Jamaica to provide an appropriate response to the Aedes aegypti mosquito and the breeding of that mosquito.
Netherlands-based Jamaican Anne-Marie Brown has committed to provide $1 million annually for the next 3 years to upgrade the Olympic Gardens Health Center in Kingston as part of government's Adopt a Clinic program.
I heard that I was the first individual to actually adopt. And for me, I believe that when God blesses you, because I am blessed, you have to give in the same capacity, the same measure of your blessing. That is how you should give back.
The adoption process basically does a couple of things. One, it says you are volunteering as an adopter to give financial or other types of support to a facility. We will recognize you with a plaque on the wall inside, which we will unveil. Those resources are going towards a needs assessment that is done.
The safety audit of homes for children in state care is now completed and is currently being reviewed by the Child Protection and Family Services Agency. The audit was requested by Prime Minister Andrew Holness following a fire at the Walker's Place of Safety in January last year.
Once Cabinet has reviewed, then the decision will be taken to make it public. But just to say, we have already started to implement some of the recommendations from the audit.
And finally, the International Monetary Fund's resident representative to Jamaica says the country is ready to exit the fund's program come November.
Jamaica has set a new standard for the region, not only for the region, but really for the rest of the world. We've seen a country where the ownership of the economic program was far-reaching. We've seen a country where the broad-based social consensus has allowed two successive administrations to implement sound policy. We've seen a country where we had continuity in the reform and Jamaican people being engaged in the process to be part of that transformation. So we believe these are features that many countries could learn from.
And those are some of the stories making news this week. I'm Simone Wolf.
The latest and best practices in cardiac and vascular treatment and care are being offered in a state-of-the-art medical facility now housed at the University Hospital of the West Indies. Health and Wellness Minister Dr. Christopher Tufton officially opened the facility earlier this year. Let's check it out.
Jamaicans and other people from the Caribbean region, indeed visitors from around the world who may require cardiovascular treatment and care, can expect the best right here at home. The government of Jamaica has been on a mission to retool and modernize the health sector. The University Hospital of the West Indies is among the health facilities undergoing transformational changes to keep abreast of the latest in healthcare technologies.
What we want to deliver to the people of Jamaica is a state-of-the-art facility that will enable us to provide all the healthcare needs of our citizens.
It's important that as a country, we are able to provide that advanced and higher level of care that is needed when some of the most complex medical conditions requiring expertise present to us.
In keeping with the hospital's strategic plan and vision, several new developments have been taking place. Among them is the establishment of a cardiovascular interventional suite with state-of-the-art equipment. The suite of equipment cost $2 million, while another $51.5 million Jamaican dollars was spent on construction and infrastructure improvement.
This is an indication of a desire to keep pace with advances in the technology that's around to ensure the delivery of quality care.
The project, which began in 2018, was established through a partnership involving the Ministry of Health and Wellness, the Culture, Health, Arts, Sports and Education, Chase Fund, and the National Health Fund, as well as international partners, Philips International and International Medex.
It's an amazing achievement. We should be, in a very consistent way, strive to always be on the cutting edge, given our mandate as a regional body to deal with the capacity building mandate that we have.
This modern facility, now available at the University Hospital, enables specialist clinicians to perform minimally invasive tests and procedures to diagnose and treat some of the most complex cardiac and vascular interventional cases.
We have what we call the biplane or dual interventional suite, but what we have done is combine that with echocardiogram within the same suite or an ultrasound. We also have within that suite what we call an anesthetic machine or ventilator that can put the patient to sleep. And we have continuous ECG monitoring. So the combination of equipment combined with the most important, certainly the interventional, the dual biplane system, allows us a wider range of diagnosis and treatment for the patient with the highest degree of accuracy.
It is a multidisciplinary suite. As such, it is equipped for cardiologists, interventional radiologists, vascular surgeons, and cardiothoracic surgeons. Hospital administrators are targeting a gamut of procedures to be performed routinely in the amount of about 50 cases per week. Most are expected to be patients affected by various heart conditions.
But they also come with diseases of the brain, possible strokes, possible abnormalities of the vessels in the brain. They also come with abnormalities of the peripheral vasculature, blockages in the legs, difficulties in the aorta. And so really a lot of the care will speak to cardiac disease, vascular disease.
The suite also has the capacity to deal with conditions such as renal disease and cancers. A number of emergency procedures were among the first set of cases dealt with after the facility went operational in the first half of 2019.
We have done coronary angiograms, we have done percutaneous coronary interventions with stenting, and we've done cerebral angiograms, looking at the vessels to the brain. We have done aortic stenting.
These and other procedures taken on at the interventional suite are making a mark on efforts to tackle the monster of non-communicable diseases and indeed saving lives.
A third of all deaths in Jamaica, between 18 and 20,000 deaths, die from cardiovascular disease. The Global Health and Lifestyle Survey says that 1 in 3 Jamaicans are hypertensive, which speaks directly to this kind of condition or series of conditions which requires an intervention suite. Nearly 50% of those who are hypertensive are unaware that they are. And it's clear that we have the human capacity to do a lot.
Opportunities also created from this interventional suite for the UHWI's Faculty of Medical Sciences to not only teach, but also put all the innovative healthcare theories into practice.
Looking at the intervention suite in operation, you'll recognize it immediately as a microcosm of what we're trying to achieve in the Faculty of Medical Sciences. If you see the unit in operation, every peg knows its particular hole, and it is working like a machine.
As the funders of healthcare in many instances, we are willing and able to support projects that add value. And I'm confident that this is indeed a very good project. So we at the NHF, we are committed to partnerships, and this one really has led to a good outcome.
It doesn't end there. The blueprint for further development at the hospital has in its design its first 6-story tower, as well as other technologies to come, including upgrading of its MRI suite and the delivery of PET imaging.
On the road to securing the health and well-being of the nation, the responsible ministry has established programs to ensure all of us in this country are in tune with the need for lifestyle practices that reduce our disease burden. The flagship promotional program, Jamaica Moves, encourages healthy eating and regular exercise. Find out more in this next feature.
Get moving for a healthier you is the passionate call to action by the Ministry of Health. And it's creating waves across the country as Jamaica moves to tackle non-communicable diseases (NCDs) through regular physical exercise and proper nutrition. Within schools, the Healthy Lifestyle program is being rebranded through the Healthy Youth Positive Energy Hype initiative.
The reality is that 7 of every 10 Jamaicans would die each year. And we have about 18 to 20,000 deaths in our country each year, die from what we classify as non-communicable diseases. Lifestyle diseases, to put it simplistically. And it's all about our physical inactivity and our consumption patterns, our habits.
The Ministry of Health is on a mission to change that by getting every Jamaican to engage in at least 30 minutes of physical exercise daily. In fueling this fitness revolution, the ministry launched the Jamaica Moves campaign under the theme, More Moments, More Memories, and More Life.
If you do what we are promoting, then as the tagline says, you'll have more moments, more time to spend with your family, your friends, do what you enjoy, more memories, capture all of those lovely memories, and more life.
Through promotional events across the island, the ministry is showcasing entertaining exercise workouts that persons can go home and practice. Free medical checks are also being provided.
It's part of the preventative healthcare method, and that's the approach that we're trying to take before we get to the part of the curative side, which is hospital care.
Jamaica Moves is also developing walking trails in each parish and partnering with local walking and running groups. This is all part of the National Strategic and Action Plan for the Prevention and Control of NCDs for the period 2013 to 2018. The plan covers 7 main categories of diseases: cardiovascular conditions, cancers, chronic respiratory diseases, diabetes, sickle cell, mental health disorders, and injuries.
Rarely do we speak about the need to change our lifestyle in our own interests as individuals. And it is cheaper to do that. 1/3 of your income, according to the World Bank, if you get arthritis, diabetes, cardiovascular disease, and all the others that are linked to lifestyle, 1/3 of your disposable income, the World Bank says, will end up being spent on treating those ailments. So it affects the bottom line and your pocket also.
Many persons like this man can testify to the benefits of living a healthy lifestyle, which extend beyond monetary savings.
All my family have diabetes. One night, I see my hand hook up like this, pull in, and get cramp. My feet then start to cramp. The morning, I put on my clothes, get ready and go to the doctor. He do my blood sugar level, and it was 29.5. And he said, oh my God, you almost kill yourself. So the doctor said, I know what to do, Mr. Reed. He says, yes, sir. So I was weighing at the time 285 pounds with a big tummy like this. So he said, go and cut out your belly. And you know what I mean. So I said, I understood, doctor. I'm going to change my diet and I'm going to take up exercise 1,000,000%. So I start off by 1 mile back and forth till I end up doing 10 miles. Exercise is the key to good health. Eat right, change your diet, less carb. Remember to put the running shoes right at your bed. As you step out of your bed, you step in. And the first thing, you drink 1 cup of water before you move. And eat a lot of fruit, eat a lot of greens, and always have 1 glass of the green juice every week.
Dedicating 30 minutes out of every day to physical exercise may seem a big challenge, but begin with just 1 step and you'll find it becomes manageable. Regular exercise helps prevent damage to your heart's artery from high cholesterol, high blood sugar, and high blood pressure that can lead to heart attack or stroke. Medical experts say aerobic exercises also improve the body's blood circulation and reduce the risk of type 2 diabetes while helping to control blood glucose in persons living with diabetes. There are exercises tailored to building muscle and losing weight, increasing strength, and improving flexibility. Corporate Jamaica is on board with the Move for Health, and even more are encouraged to take on the Jamaica Moves Corporate Challenge. It involves companies and their staff signing up and participating in the various run-walk events.
We want to mobilize as many companies as possible So what we say to you is sign up your company, get registered, endorse the Jamaica Moves brand, which is a national brand. The reality is, many of us don't practice healthy living. So we need more people to do it. And by doing it, encourage others so to follow.
Persons can learn about the various Jamaica Moves challenges and events by logging on to the Ministry of Health's website moh.gov.jm or jamaicamoves.com. Staying fit and healthy is everybody's business, so get moving for better health.
As we continue to focus on the subject of safety and well-being, let's turn to the importance of protecting yourself and property from fire hazards. A fire can cause great loss and grief. In this next feature, you'll learn what you can and should not do to keep your property and people safe.
Fire! Fire! My bed, my clothes.
Same script, different day. What's worse, sometimes a human being, even a child, dies in these unfortunate situations. The loss of lives and valuables as a result of fires is impacting those who remain behind. The mental effort to get up from the ashes. Taxpayers too are being burnt, as more dollars are being shelled out for fire emergency operations. Homeowners must implement fire safety plans.
Right, it's important for us to fireproof our homes because we have our families and we normally have strict guidelines as to how you operate within the home, how you store your chemicals as it relates to your kitchen, how you manage your heat sources, how you handle your plugs. So the safety measures that you take as it relates to the protection of your children.
Here are a few situations you must avoid to prevent losing your home to fire. Finally home from a tired day at work. The first thing many people do is get something to eat. Now, this is when a fire safety sin is usually committed, having a cigarette while tired or the stove is left on. What else at home are you not doing safely? Like this, using a computer or mobile phone on the bed. So they should not be used on flammable surfaces such as beds or sofas.
Leaving your cell phones on your bed can trigger the ignition temperatures of that spread or sheet and can actually cause a flame. So we encourage you not to leave your cell phones unattended. It's an active source of heat, and worse when it is charging. It has caused many house fires based on our statistics.
Between 2010 and so far in 2019, 100 children were burnt to death. One of the main causes of these deadly fires, a child left unattended with burning candles.
Based on investigation from fires, we find that most of the times it's because we leave our children unattended, right? So we leave them with the matches, we leave them with the candles, we leave them with the lighters, and we leave them with maybe a laptop or an iPod, something to keep their attention, but they are fascinated by a flame.
Here are some other factors found by the brigade to be the major causes of fires within the home. Clothes put to dry at the back of the refrigerator. Storing plastics on cooking gas cylinders.
We identify this as a fire hazard because if you notice, it is pretty much close to the source of heat, which would have been the stove itself. All right? So we can have a spark from this. The Jamaica Fire Brigade encourages that cylinders over 30 pounds should be stored outside. So here we have two heat sources, a microwave and a toaster oven. All right? Plus, there is a charger plugged directly between both sources of heat. What we encourage is that there should be sufficient space to allow for air to pass through. In the bathrooms, the heat source is, for example, your blow dryer. You leave those on, running while you do other stuff, while you wash your face, something. But leaving them near your towels and your other materials that can burn, your clothes, that can spark flames.
As for power strips, they should not be overloaded.
So we also encourage that if you're using extension cords, do not run them behind furniture, do not run them under the carpet, because the constant pressure on the cords themselves will cause breakage. Again, if it is near a combustible material, it can cause a fire.
It is crucial that these fire safety measures are adhered to. Every home should have a fire safety plan that is known by each member of the household. Lastly, but very important, keep the numbers of the nearest fire station saved in your telephone contacts.
The general public can make a request for us to come inside the homes, check where you should have a smoke detector, check where an extinguisher should be, because you should have these in your homes as well.
On the board this week, the Visionary Youth Club and I Care Jamaica, in partnership with Sandals Foundation, Sandals, Beaches and Grand Pineapple Negril, will be hosting its back-to-school treat on August 24. It will be held at the Darliston Primary School. Save the date. There will be a lot of rides, games and prizes along with school packages. The back-to-school treat will start at 10 a.m. Also, the Clarendon Health Department is being relocated from 1 Muirhead Avenue on the grounds of the Mapen Hospital to 1 to 3 Jackson Street in Denby, Clarendon. The new location is beside the Denby Primary School. The Health Department will begin offering administrative services from its new location on Monday, August 19. All other services, including food handler certification, mental health, diabetic retinopathy, and child guidance clinics, will remain at their current location on the Mapen Hospital compound. Operation times remain the same. The phone numbers for the Health Department also remain the same. And residents living in and around Spanish Town St. Catherine are being asked to gear up for participation in the Spanish Town Culture Quiz. The competition is put on by the Diana L. Walters Charity Foundation. It will be held from October 21 to December 21 this year. For more information, visit the foundation at 9 Chester Avenue off Brunswick Avenue, Spanish Town St. Catherine, or call 876-853-2497 or 876-336-2230. And that's all for our community notices this Saturday. If you have something to share on our notice board, give us a call at 876-922-8680 or email cbishop@jis.gov.jm or kferguson@jis.gov.jm.
We've come to the close of Jamaica Magazine for today, but we hope you've been enlightened and ask that you do join us again tomorrow for more. Until then, continue to watch these and other programs by logging on to our website, jis.gov.jm, or subscribe to our YouTube channel. You may also find us on all the major social media platforms. On behalf of the entire production team, I'm Adrian Atkinson. Thanks for watching.
This has been a production of the Jamaica Information Service, the voice of Jamaica.